Okay, let's get started. Good evening, everyone, and good morning, some of you. So, in today's class, we are going to discuss about one of the most important topic because I personally think this is one of such a topic which is going to cover a lot in the NCLEX and also it's covering in the NORCET examination for mains perspective. So many students, they always have a question mark, how to solve these type of questions. When it says first, initial, priority, highest priority, next strategies, like next. So when you see these words in your question, how do you solve those questions, right? So this class is going to be very interactive because you are going to participate here together with me, answering some questions as well. But before we practice the questions together, let's try to understand why these questions are important. Not just for your exam, but also these are important in real life practice also. So the very first thing what I know is, especially if you're writing down the exam for the NCLEX. So these questions, they almost cover 70 to 80%, I would say. And sometime even I know some students, they also go almost about 90%. It's all about the priority type of questions in your exam. So these questions are very, very highly weightage because they ask you these questions in every single system. Doesn't matter you are studying the mental health, maternity, or you are studying the, let's say, fundamental type of questions you're doing, or even the medical surgical nursing, like any system you're picking up, it always include these type of questions, even in your exams. And as I said, while you're studying at home for these examination, these questions gonna help you a lot. Now, the next one we're going to talk about here is why they're important. Like, as I said, first of all, they cover majority of the questions, but not just the majority of the questions. I personally think these NCLEX test question, they basically test your decision making skill. Like, how do you make a decision as a nurse? When you have a patient in front of you, not just in the computer screen, but also in the real life practice scenario. This exam is not about the memorization, like you remember the sign and symptom, you remember the drugs and everything. And this is not how the questions also coming these days, everyone. And also in your practical life also, nobody going to ask you, you have a patient in front of you, right? What symptom do you know from the CHF? Maybe you know something from the books, but it's not present maybe right now, right? So that is why you need to understand decision making skills. Like, do you really know when you have a patient in front of you, like, do you really know what are you going to do first at that time to save someone's life, right? Maybe there is 4 nursing interventions in front of you for same patient. Maybe everything you're supposed to do, but what is a more priority right now in front of you in that question? What are you going to do first, right? So this exam basically check your decision making skills right at the same time, depend upon the question what they have given. And also, lot of students know that this exam is all about the safety exam, right? Why do we call this as a safety exam? Because when you have 4 different answers in front of you, do you really know if I pick such an answer which can save someone's life today, right? So that is why we always call it as a safety exam, because we want to see if you really know something as a nurse, what to do in that way, right? But you will see with me how to apply this everything in the questions when we go to the next slide. In the meantime, I'm live at the same time on YouTube and also live on the Zoom classes right now. So everyone, whenever you have any questions, just use your chat boxes, please. And in a free time, when I get the time after 2, 3 slides, I always give you opportunity to ask me the doubts and question, and I will address your doubts at the same time. Okay. Now, the next thing is about why I feel like another thing, why these questions are important. Another point, what I see is Sometimes, the question doesn't say first, priority, initial. They never use those words, like not even most and best. But still, those questions demand as a first answer, what are you going to do in there? So this is a lot of confusion. I have seen recently into my chat boxes in the WhatsApp. So many students ask me like, ma'am, what if the question doesn't say that word? Then how we can pick the answer? In that case, I always say think as a first. Still think as a first, even if the question doesn't say, because it's automatically meaning is if you have a patient in front of you and that situation is in front of you, what are you going to do first, even if the question doesn't say that? And I'll show you those examples today. And then another most important thing, what I feel like it that these questions actually even decide if you're gonna pass this test or if you're gonna fail this test, right? Because let's say if you have two different scenario in front of you, right? One student know which answer is correct as per what you learn from the books, right? Something you learn as a part of the content, this is the right answer for sure. But that answer which you pick actually, that is the late nursing action because the question maybe doesn't demand that and you pick that answer actually. Right. So that is even maybe correct, but not what the NCLEX needed from you in that question because they want you to choose that action or that answer you can say which they're thinking you must have to do at that time in that particular situation as a first answer, right? So basically what I mean to say is maybe everything sounds good when you see the four options or three options or you're stuck between two options in the question, but you need to pick that answer which you think that's supposed to comes first before you go for the other nursing intervention or another assessment into that particular question, right? So you will apply this everything with me. So when the NCLEX see, those two different candidates, they're gonna reward the timing, urgency in those questions, not something what you know from the books. And also students, it's a very important reminder, not something what you know from the practicum. Okay, because remember, NCLEX is about a universal examination. It's a real world nursing, a perfect world nursing examination. That's not something what you see in your hospital while you're practicing somewhere. That's not something what you think your other colleagues, nurses is doing on the floor with you, or the doctors are following with you on the floor. Because when we go to work in the hospital, or depends which site are you working, depends which country are you working, you follow that rules what you know in your site perspective also at that time. So practical situation could be different, right? But the answers what you need to pick in the NCLEX, that could be the different, right? So that is the reason I have seen so many nurses, they fail this exam, not just because, they apply the experience and everything what they see on the floor, right? But also what they learn just from the books, right? So basically, you need to know some strategies, how to pick the answer. Still, even if every answer sounds correct, that's something you need to know for this test, not something what you read in the book, not something what you work on the floor, because this is a universal exam. Remember, everyone, doesn't matter you are the international graduated nurses, doesn't matter you are graduated in US, Canada, Australia, UK, any other developed countries also, you still don't follow blindly and apply the answer what you see on the floor, right? Now the last thing what I feel like why this is like a very very important, because in real nursing, NCLEX is basically testing, after you pass this test, right? Do you really know how to work under the pressure in the real life scenario when you go on the floor? So basically, these exams, they make you expert in good things, what to do first, what to do next, and everything. But I know everybody works in a different way when they go and work on the floor. Maybe you follow something shortcut at that time. Maybe you think what is important for you at that time. That's something you do, depends upon the client situation. Maybe it's a good answer what you do at that time. or sometimes you don't want to do it, but you still do in the real life, right? But basically, these exams, they make you prepare, in the real life pressure on the floor, how you think what to do first at that time with your patient, right? So that is why I personally recommend watch this lecture until at the very end. And if you find any question, any doubt from me, even you want to watch this video later on as well, always put the your doubts in the comment section for me so I can always get back to you as well. Now, this is about importance. Now, what I think is, before you look into any questions, these are some tips which everybody needs to know, right? And the sad part is nobody talks about it, right? Why? Because I personally think everywhere on the internet, in the books, everywhere, even in the nursing school, when we learn in the nursing school also, everybody knows that ABC, airway comes first, then breathing, then circulation, assessment. You always do nursing assessment before intervention, like look for your nursing processes and everything, right? But I personally, what I do is when I solve any NCLEX style question, or even let's say I'm working on the floor also as well, I never blindly follow ABC or blindly follow nursing process. What do I mean with that, right? Basically, especially if you're getting the questions in the NCLEX, you will get a most of time in the trap of ABCs and assessment, the nursing process as well. So a lot of students I know, they pick the answer, assessment comes first and airway comes first. Don't blindly follow that, because if it's that easy, remember, then everybody can clear the NCLEX, right? But this is not that easy when you go to the real exam, because the exam people, they know like this is something going to be effective there, right? Like everybody will pick blindly, the ABC comes first and airway comes first. You pick that answer, oxygen all the time, right? But what you need to do is, I personally recommend, I never say don't follow these at all, like even the Maslow hierarchy also. I always says that keep this thing at the back of your head always. You still keep at the back of your head ABC, nursing process and everything, Maslow, whatever you're learning. But at the same time, use your critical thinking skills. Why is that the answer you want to pick, right? Is just because you want an ABC or anything happening to your patient right now, right? That's why you want to put the oxygen maybe at the first as the right answer in there, right? So use your brain always, use your critical thinking always. Why option A is the right answer? Why not B, D, C, and D is not the right answer? What if NCLEX change the question, option number A? Is there any different answer could be there as well, right? So please use your clinical judgment skills, improve your critical thinking skills when you practice like this at home. Don't blindly just follow ABC nursing process. This is a big trap, and I want to talk about it today. So when you practice question after watching this session, you will understand what do I mean with that, right? Now, another thing is in the tips, which I want to give it to you because I apply these things when I do the questions, right? The first thing I apply is, when you enter in the patient room, right? You always ask yourself, imagine into that scenario. What if I enter in this room? Maybe I have to do everything in there. Is there something that I can only do one thing first when I just enter the room? I don't get a chance maybe to go back there again, right? But something which I have to do first when I just enter the room, I don't get a chance to do that because I only have to do one thing when I just enter the room, right? So think as a that way when you look at the question, and also it depends upon what situation they give it to you and what is the key word into the question, right? Keyword I always says in my every video is always hiding before the last line of the question. And if you are the first time candidate on my this platform, I highly recommend it. Watch my old videos where I exactly mention everything, how to find out the keyword into the question. Because keyword finding is very important. Otherwise, you will read the whole question and you think everything is important in the question. No, the answer is not. Only keyword you need to focus more always. And based upon the keyword, you always think what you're going to do first if you have this thing in front of you, right? And also, another important tip for all of you, always try your best when you do something as a first, even in case of an emergency. See if you can do something as a nurse, at that time, rather than you calling someone right away, calling doctor, maybe physician, right? Calling a surgeon in that case, calling charge nurse in that case, or families in that case, dietitian, or any person, right? So before you call someone for help, right? Can I do something as a nurse first? Even if this is an emergency, can I do something as a nurse first, right? So you look at the four option and see what you can do, because this is your exam. This is not somebody else's exam, right? Excuse me. So I really want to focus on this thing, because a lot of time I know the students, they blindly click the option notify physician, right? I'm not saying that the notify physician cannot be the right answer. It can be the right answer also, depends upon the option, what they give it to you. If you think by looking at the other option, I cannot do anything as a nurse in this scenario based upon the given option, then only left answer is notify physician, maybe in that case, right? But first try your best. Can I do something first as a nurse, right? So this is how you think in those questions always. Now, let's try with the first question on my screen, and you will understand more now how to apply all these tips and strategies, what I'm talking here today. And you will learn with me in every single question how to apply this thing. And these are the sample questions, of course, which will help you a lot to understand what type of question can be with the word first, priority, initial, highest priority, next. Yeah, even I bring some case studies today also, because in case studies, you can apply the same method also if you have the first priority initial words is in there. Now, look at the first question on the screen with me, and you can also definitely use your chat boxes at the same time. Put the answer is in there. If you think you want to come on the mic for some reason, you have a lots of doubts for me, maybe, right, for that question, feel free to let me know. You can always participate, because this is a classroom. This is not something I'm teaching only and you cannot participate, right? You need to participate too, everyone. So if you feel like you want to come on the mic, just let me know at that time. Okay. Now, the first question I have is a client you have, which is a child with the meningococcal meningitis, is being admitted to the pediatric unit, right? Now, a lot of time what happen is when the nurses read this question, they take a break on this word, meningococcal meningitis, right? And they start overthinking a lot about this topic. Don't think about it until the question really needs it from you as a part of the content, right? So you simply read the question and then you look what the question needed from you. So they said, in preparing for this patient arrival, which action should the nurse take first? Maybe you're going to do everything, but what comes first based upon the keyword? Now, keyword before the last line cannot be just the pediatric unit, or cannot even just be the admission. So that means my only keyword left is meningitis, right? So that means you have a patient meningitis in front of you. Now, what are you going to do first? That is something they wants to know, right? So when you look at the option, you have the options like institute the droplet precaution, right? So a lot of students, when you read the book or even when you do the isolation precautions also, meningitis is a part of the droplet precaution, right? I can see someone answer in the YouTube. They said airborne precaution, not the airborne. If you think answer is airborne, I highly recommend you need to read the content also. Sounds like you're weak into that isolation precaution video, right? But those who are good in content and they already pick the A answer, they know the droplet belongs to the meningitis. So hold on, maybe you have to do that first, but compare with the next option always. Don't just jump right away into there, right? The second one we have is assess the vital signs, right? Now, assess the vital signs. See, this is a trap. Assess vital sign could be, I don't know if I need the vital signs or not, but you compare it and see the keyword is it just admission right now, right? So do you think you want to put on the precaution first before you take the vital signs? Or do you think the vital signs will come first and then you will put the person on the precautions after that? This is how you should think, right? So I would say do put on the precaution first. You don't want the spread of the condition further in there. So to prevent that, precaution first, and I'll do the other nursing interventions after. Ask the parent about medication allergy. That can wait. I can ask that later on also. Even this is also one of the right answer as well. Inquire about the health of the siblings at home. That is a part of your again nursing assessment, the history taking also. That can wait, and I can also ask this question later on also, right? So see, everything sounds good, but I would do the droplet precaution first. And then after that, I think vital signs is very important for me. What if NCLEX do not give me the option A? Then I'll pick the answer B in that case, right? So after the B, now what do you guys think? You think the C will come first or the D will come first, right? This is how you will think. I would say, the siblings at home. Okay, I would say C will come first because allergies question is more important for me as compared to the asking who else is sick in your family right now, right? So that thing again can wait for me because right now I need to focus on the patient condition. So for me, it's important to know like if the patient has any medication allergies or not, right? So A and then B and then C and then D. Why did I tell you the sequence? Because if you don't have the A option, you pick the answer C, B in that case. What if A and B both are not there? The C will be relevant then. What if A, B, C is not relevant in there? Then D is the only left answer in that case, right? So this is how you think critically, how to solve the questions as well. Now I'm going to quickly on your chat boxes right now because I want to see how everybody participate at the same time and if you do have any questions so far for me or not. Okay. I know it's a nighttime in India. Some students they said we are going to sleep also. Okay. Yeah, you can watch it later on also. Yeah. Okay. Okay. I can see some students they always pick the answer A. Okay, perfect. Now, YouTube students, I want to see if you have any doubts so far for me in this particular question or not, right? Okay, pretty good. Now, I think everybody's good so far with this question. Let's move on to the next question right away and see how you solve this question for me now. So in this question again, maybe I'll give you guys the mic a little bit as well, whoever needs it, right? If someone want to participate it, just let me know so I can give you guys the mic at the same time. Now, in this question, a client is receiving a unit of the packed RBC. Before the transfusion was started, the client blood pressure was 90 by 50. The pulse they give you 100, respiration is 20, and the temperature is 98, right? Now, did you guys notice when I read the question, I'm not going to read mercury beats per minute, breaths per minute, because your brain automatically know this, right? So save your time when you're reading the question. Now, 15 minutes after the transfusion begin, your client blood pressure is 92 by 54. Then you compare with the previous one, and the pulse is still 100. Okay. The respiration is 100. But I notice there is a fever right now. And this is also one of my main keyword before the last line, right? If you notice like a fever, right? And it's already 15 minutes the transfusion reaction is started. Do you think you want to stop the transfusion first and then raise the head of the bed? Or should I raise the head of the bed first and then stop the transfusion? This is how you should think, right? Or do you think, first of all, just give the antibiotic and then after that we'll raise the head of the bed and stop the transfusion, right? So this is how you look into this question. For me, I would stop the transfusion first, right? And then after stopping transfusion, what I'm going to do is I'm going to raise the head of the bed actually, because this person could be at the trouble for breathing at any point if this is a transfusion reaction now. So after that, antibiotics, I don't think so I need it right now, right away, right? But definitely I need to stay with the patient, and I would say look at the other reaction signs. I'm just going to do the head of the bed race and see if what is the oxygen look like. If that needed, I'll give that first, and then I'm going to check the whole body maybe at that time, and see if any other signs of reaction is there or not. And then after that, after making sure patient is okay and fine, nothing is happening, then I will call the physician. But if something is happening a lot right now, I would stay with the patient, never leave the room, tell my another nurse to call the doctor right away, right? So this is how you think critically in that situation. So the answer for this question is number one, stop the transfusion, right? And I think everybody pick up the answer number A also so far, which is good, but you can always stop me if there is any confusion in this question for you. Now, let's see the next one. The next question we have is the client says, I promise not to touch the IV catheter anymore because I don't want to slap again. Which nursing action you want to take first? Maybe again, you have to do everything, but think about it. What is the question says? So imagine I'm your patient right now and I'm telling you this thing. I promise not to touch the IV catheter anymore because I don't want to be slapped again, right? So when I'm saying this thing in front of you, what is the first thing you're going to do right away before you do something else, right? Do you think when I say this, you're going to check my neurological right away? Is that something you think is very important? And I have to finish the neurological first in this person, right? This is how you should think in this case, right? And then after that, if you think it does not need it, eliminate it, right? If you think you're confused, you want to put it in, then compare with the option number B, right? The B says ask the nursing assisted personnel. So that means the person who is working along with your team with this patient, right? So ask this person if the client was slapped while providing care. Maybe you want to collect some history. I would say between A and B, let's keep the option number B because it sounds a little bit relevant so far, right? A is not relevant so far. Now you compare between B and C. The C says, ask the client where the slap occurred. And under what conditions, right? Now imagine everyone, you're standing in front of the patient. Do you think you should ask the patient first what exactly happened at that time and then you ask somebody else, another staff member on the floor? Or do you think you want to just quickly go and ask someone and come back to this patient later on, right? I would say check with the client first, right? Very important, gather the data and information because it sounds like an abuse maybe. We don't know, right? So I would consider looking into the patient first. If my patient is okay, what exactly happened at that time? Can you talk more about it if possible, right? So this is how I will collect the information in there. And then after that, I will go to another person if needed. Usually it's not needed. After you collect the information, then you simply just report it to your supervisor, right? But you only go to another person if something you need to ask. But in this scenario, I'm not going to confront. What I will do is I will just gather the data and tell my nursing supervisor. So my nursing supervisor can collect the data from the other NAP, what exactly happened at that time, right? So this is how you think critically back again. Practically, you put yourself in that situation. Document never comes first. You do something first. Well, until unless everything normal in the question, then you want to maybe document it. But this is not about something normal that I have to document the things right away as a first answer. That can wait, right? So I'll go for C, then I will go for D. Why D? Because it's also covered reporting the nursing manager and I will document it. Might be I have to fill up the nursing incident report also at the same time. And then after that, I don't need A and B at the moment. So both are irrelevant at this point for me being as a nurse, right? See, this is how you should solve this type of question. I hope everyone is learning with me here because my job is not to give you just right answer on the screen. I'm going to make you guys think critically along with me today how to pick up the right answers, right? Now, let me go back again to your chat boxes. I can see everybody pick up the answer number C, C, C. And let me see if there is any specific doubt for me as well. Hmm. Yeah, this is a trap question, Mohammed. Yeah, this is how they can make you trap. Okay, perfect. Okay, no need to raise the bed because the respiration is in normal range. Perfect, perfect. Do you guys want to come on the mic still? Anybody who want to participate together at the same time with me? If yes, just let me know who wants to. I'll give you guys unmute mic at the same time when you go to the next question with me now. Okay, so let's look at the next question on the screen. The next question again, show you how to pick up the right answer, right? The nurse says the client here, gestational hypertension. Now, which finding is the priority for the nurse to report it to the doctor? Maybe everything you want is supposed to report it in there. Well, what comes first? You think that is something bad that cannot wait? I think I have to tell the doctor right away when I see something like that inside the room, right? Now, you ask yourself, is the +1 proteinuria, that's something an emergency for you? A continuous headache could be an emergency for you. Between 1 and 2, I'll keep as a nurse maybe number 2. This is not something important for me right now, and that's something everyone know this is expected at this point, right? So +2, even it says +3, that can wait. That's not something a damn important emergency for me. I have to tell the first thing to the doctor right away, right? So again, between B and D, even if the weight gain is more than 1 kilo, right, in the past week, that can still wait for me. This is not a medical emergency for me. I have to tell first thing to the nurse right away. So I think this is a pretty simple and easy question. The more we go to the next screen, the more you're going to find the difficult questions in there too. But this is how, when you have 4 different symptoms in front of you, which symptom you want to pick first, pick that which you think that cannot wait. And that's something you want to tell the doctor right away. So I'll go with the answer number B, and the rest everything can wait now, right? And I can see everybody pick up the answer number B so far, which is good. Seems like you know about this question pretty easily. Now let me take you to the next question in here. The next question we have is the nurse is talking with a client who sustained a sprain of the left ankle and has been using crutches for the past week, right? See, this is before the last line of the question, right? That means my keyword is using crutches, right? And there is a sprain on the left ankle. That's why using crutches, right? Now, which of the following statement by the client would be the priority, the first thing for you as a nurse right now to follow up, right? So between A, B, C, and D, now think about the answer, right? I'm going to look your chat boxes now as well, but I'll show you how I'm going to do it as well. The first thing is I have been experiencing weakness in my hands and wrist. Hold on. Why there is a weakness in your hand and wrist and you're using crutches at the same time? Something happening. Maybe a pressure on the nerve, like a radial nerve. I don't know. Hold on. That requires follow up for you by the nurse. And then when you compare between A and B, the B says occasionally experience, not all the time, occasionally brief muscle spasm only. I think that can wait, right? So between A and B, A is something more for me. I have to do something, look into right away. Now go between A and C. The C says the muscles in my neck are tired and the sore by the end of the day. Again, they can wait. This is not something a medical emergency for me. I have to follow up right away as a first thing into there, right? Now between A and D, the D says my left ankle is swollen by the end of the day, right? Well, this is expected again if you stand or walk frequently, right? That can wait as well. So now if you look the all options, A is still the better answer as compared to the other. So I'll pick the answer number A in this case. And let me see what answer everyone pick up as well. I'm just going to look in your answer key quickly. Okay, some pick up B and someone pick up D. Pick up B, pick up D, pick up A also at the same time. Okay, when you say, let's see here. Oh, I think that was the previous question. The Mohammed says it may indicate progression to the preeclampsia. that may indicate, but it's not happening right now. You want to think not perspective to the diagnosis, but something that symptom which cannot wait for the previous question. And let me see here. Everybody pick up for this question so far. Very good. Very good. So you can always stop me back again if there is any doubt, any questions is in here for me, or you want to come on the mic. Even YouTube students also, sometime you feel like you want to participate with me live together in the class, you can always join my WhatsApp group where I can give you the access of the mic with me in the class, and you can just participate as well. Now, moving on to the next question. The nurse is caring for 83-year-old client. It's a bedridden experiencing fecal incontinence. This is like your keyword. Now, which nursing intervention is the highest priority? See, highest. Maybe everything is a priority for someone who has a fecal incontinence, right? But what comes first on the top of it, right? So consulting with the wound care nurse specialist, that can wait. This is not something I need this right away. Insert a rectal tube because you thought the person is having fecal incontinence. No, I'm not going to do it, right? And then provide the perianal skincare with a barrier cream. Sounds a good idea. So this is something I want to keep it first on the top of the list, right? Use incontinent briefs to protect the skin. Well, before you use incontinent briefs, I think skincare comes first. This is more priority to look into before you go for anything else is in here as well. So I'll go for this question, the answer number C, rather than A, B, and D. Now let me look into your chat boxes right away, making sure everybody know the answer. C, 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 C. Perfect. That's pretty good. Now let's go to the next question quickly. The nurse in the outpatient care facility is caring for a client who is blind. Okay, look at the keyword. Your client is blind at this time. Now, which of the following action should the nurse take? Now, this is the example of that question, everyone, when the word does not say anything first, initial or what. So in that case, you pick that answer which you think you want to do first based upon the condition, the keyword, what they give it to you. So what are you going to do first? Basically, if you have a keyword, someone is blind in front of you, right? So this is how I think about the question is in here. So again, when the question doesn't say anything, look for, still think about priority first initial in that case. Now, offer the client's service dog food and water. Is that something first because person is blind? Well, if I can do something for patient, maybe, before doing for the dog, maybe that can wait. So A option, I think it can wait, but you can compare with the next options. Teach the client how to ambulate with a stability cane. Now between A and B, I'll pick the B, right? But for me, the teaching can still wait, but it's better than A. So pick B for now. Now you go between B and C. The C says touch the client's shoulder before speaking to the client. Can we touch the patient's shoulder, right? I would say in this case, the patient can still hear you, so rather than just touching it, I would take a permission first. I don't think so I really require that just because of the person is blind. For me, it's not a really good answer. Like you just touch the person before you speak to the client just because you're thinking they can't see you, right? I would just talk. They can listen me, rather than touching the person. I don't think so. It's really required at this point. Now you go between B and D. The D says walk slightly ahead of the patient when you have a blind in front of you with the client holding the nurse elbow. Now, which one comes first and better as compared to the other? You have a patient in front of you. Do you think you just start talking about and teaching about the cane? Or do you think you want to go in front of the patient and ask the patient if they can hold your elbow also, and then you do further teaching whatever it's required, right? So B comes before D or D comes before B. This is how you want to think in here. Let me check your answers. Then I'll give you the right answer because this is a tricky question for some students. I can see some students pick B, some students picking up D, right? Those who pick up the B in this case, imagine you have a patient in front of you, or you are the patient, let's say. Imagine if you are the patient, imagine you're blind. For God's sake, you're not or cannot be in your life. I'm praying to the God for all of your health. But imagine if you are the blind, right? And what are you expecting from me as a nurse in that case? Those who pick up the answer number B. Do you think you're expecting from me that I just enter the room and I just start teaching you right away about the cane? Or do you think we should, communicate something else first and give you some direction where you are standing right now, where to start walking and whatever. And then after that, when you feel comfortable, then you talk about teaching and everything, right? So in my case, I'll pick the D before B. So I'll go for D once this is going to be happen. And I ask the patient, do you know where you're standing right now? Are you okay with this? Okay. Do you want me to teach you anything about the cane right now? Let's talk about it. Then I'll go for B after that, even if B sounds a good answer too, right? But D comes before B. So I'll pick D because in exam, you can only pick one single answer. So D and then B. C, irrelevant, forget about it. A can wait, right? So this is how I will pick the answer for this question, right? Perfect. I can see some students, they're also doing the sequence now, which is good. Perfect, Norman. And Gurpinder says communication come first. Gulfam says it's confusing. I hope it's not so confusing so far because I explain it. But this is how you can think, and you can always ask me question, guys, if you have any doubts, any question. I can always repeat it for you, and I can always bring you on the mic as well. Perfect. Let's see the next question in here. Now you must be like, oh my God, this is a big question on the screen. This is a part of case study, but I want to show you this is still a priority question and how you can handle it pretty easily. Okay. So the first thing is, everyone, do not read the case study first right away, blindly. Okay. I always say is look at the question first, right? If you think question demands case study, then you read case study, right? So first thing, when I have this question as a student, let's say I'm writing exam right now, what I will do is I will look the question first. The question says, drag the top 5 findings that require follow-up to the box on the right side. So top 5 findings, I have to pick and drag and drop in here, right? So obviously, even if this is a part of follow-up and they said top 5, if you think like in a simple terms, this is still about the priority at the end of the day. No, because you have like, let's say 5, 6, 7, 8, 9, 10 symptoms in front of you. So which one you think is that is on the top 5 list out of them? So that is still a priority, even if the question doesn't say that, right? So now when I see the question, I'm like, okay, they give me pulse, abdominal pain, nausea, vomiting, some bowel sounds, presence of blood in stool, temperature. I can see some fever here, and then blood pressure also, right? Now, once you know the question like this, right? Then you look at the case study, right? And see what you needed, what you don't need it, right? Now here, I don't need the age of the client because I just want to see what's going on in here and which finding I want to put into this list. So here, I can see the patient comes in emergency with the left lower quadrant. Maybe I'll highlight this one for you. Just give me a second. So it's a left lower quadrant abdominal pain, nausea, and vomiting for past 3 hours. Seems like this is still your current symptom right now. You want to think about it. This is a history. For me, it doesn't matter right now because it's an old history, not on the top 5 for sure, even if it's there. He denies previous GI problem except the occasional constipation. Okay, nothing an emergency right now still. Now report small streaks of blood. Where? Presence in the stool. Okay, current symptom, you want to think about it, right? In your top 5 list maybe. Now he expresses pain level is what? 7 out of 10. Right now, patient is still in pain. You want to think about it still because this is a present symptom. And the pain is persistent without any radiation or elevating factor, right? Okay, this is still a description of pain. And then they said abdominal tenderness noted on the palpation of the left lower quadrant. The bowel sounds are hypoactive and the client is alert oriented right now. Okay, so alert oriented, nothing emergency right now. I want to think hypoactive. I want to think about the pain. I want to think about the blood in stool because those are my present conditions right now. Nausea, vomiting is also present condition right now. And when you look at the rest part of the question, you click on your vital signs. The vital signs will open on your screen in the actual examination. And you will see the vital signs you have right now at 12 o'clock. Your temperature, the client has a fever, I can see 100.1, which is 37.8 degrees Celsius. The pulse is a little bit tachycardia, 104. Respiration rate is 20 and 130 by 83 is the blood pressure. Oxygen is still fine, right? Now you think what comes first, next. Still it's same style of question, right? It's just in the form of the case studies they give it to you. Now let me see the answer, which one you want to pick up in here, right? And then I'll tell you the my answer keys right away, right? So what answer you guys want to pick up in here? Let's see your chat boxes, please, on both sides, YouTube and even on the Zoom as well. Okay, Gulfam, pick up temperature and pain. Good. Okay. And then, okay, you said 1, 2, 3, 5, and 6. Norman want to pick up the 1 also. Okay. So when you pick up 1, Norman, why not number 4? Maybe you want to type it for me again. And then Gurpinder says 1, 2, 5, and 6. Gurpinder, why number 1? Why not number 4? Why not number 3? Right? Okay. Pain, temperature, Binol. Okay. Temperature, pain again. Nausea, vomiting, blood by Brenda. Okay. And YouTube students, I can see you pick up the pain so far only. Not just the one answer. You need the 5 answers in here, everyone. But this is still the part of the priority, right? See, what I'm going to do is I'm just going to look at the list. Pick that answer first, which you don't want to break it down, right? I'm going to pick up these ones for sure first because I want to think about the infection here. I want to think about the presence of blood in stool, right? So these two, and then after that, patient is still in pain, right? So I want to think about this one too. I think pain cannot wait right now because that's basically aggravating the other physiological changes right now. So the pulse, which is high, or the blood pressure changes, that is because of the pain and fever right now, right? So this is because of the abdominal pain. So the abdominal pain, I want to keep it in, right? And definitely why hypoactive bowel sounds at the same time. It's constipation is in pain in here, right? Okay, so you find 1, 2, 3, and 4 answers, right? Now you think between pulse, nausea, vomiting, and the blood pressure. I would go with the nausea, vomiting. You know why? Because it says it's almost past 3 hours. Patient is throwing up and having a vomiting and everything, right? And the pulse, which is high, blood pressure changes, that's all because of nausea, vomiting, and pain and fever, right? So that's not an emergency for me that I have to look into right away. This symptom can wait, right? Because if I treat these things, definitely the pulse and blood pressure, that will be okay after that as well, right? And now the top 5 answers, I want to pull it out in here as well because uh, it will be easy for everyone to see it, right? So I'm going to go with number 2, number 3, and then number 4, number 5, and number 6. In the exam, you're not going to write it down 2, 3, 4, 5, 6. You have to hold this and pick up this option and drop it up in here. So actual full statement needs to be here as well, right? So this is how you do this type of question. For me, it's again one of the easy question, not that difficult. If you think in the form of what comes first and priority, right? But again, it required a lot of practice. So the more questions are coming on the way, the more you practice, the more you understand how to handle these type of questions in your NCLEX. Now let me see What other type of questions are in here for me? Yeah, that's what it sounds like, Gulfam. And let me see here. The other students, they put the numbers is in here. Very good. Okay, there you go. You got the answer as well, Muhammad. Okay, Jatinder ji, let me check your answer too. And there's a question by Sema. Ma'am, arrangement कुछ भी हो सकती है. Okay, I'm going to speak Hindi only for 2 minutes, everyone. So bear with me because I need to reply back to this question. So I think आपका क्वेश्चन ये है साइमा कि इसका अरेंजमेंट कुछ भी कर सकते हैं, मतलब किसी को भी किसी तरफ डाल दें, है ना? ओके यू कैन, बट व्हाट आई रिकमेंडेड कि आपके मार्क्स लूज ना हो, आपका नेगेटिव स्कोरिंग में मत जाए, तो डेफिनेटली पहले आप वो सिम्टम ऊपर डालेंगे जो आपका ज्यादा इंपॉर्टेंट है. वेरी गुड क्वेश्चन एक्चुअली. तो what I'm going to do is now I have to pick that symptom first, which is more important as compared to the other. ठीक है ना? So what I'm going to do is, because she's asking me question, what if we have to put this in the form of what comes first and next, right? So now I'm going to do is, I would put the pain first because that aggravates everything and I need to treat this thing first quickly so they can stop the rest of the further symptoms, right? So I'll put the abdominal pain on the top of the list, right? And then after that, I need to look into nausea and vomiting now because it's been 3 hours. Why patient is throwing up, right? Let's try to stop the vomiting as an X because I don't want the patient to go further in dehydration and the fever will be high further as well, right? And then after that, I will pick up the answer fever as a next because it will be very quick. You know, you give a medication for this and reduce it down, and then you can go to the next nursing intervention, right? And then the one we have presence in stool and hypoactive bowel sounds, right? Presence of stool will come first. So presence of blood in stool, I'll treat it first. And then I will look into hypoactive bowel sounds because I know it's a constipation and everything is in there, but that can still wait for me, right? So this is how, again, you think about this question. So why did I reorganize everyone? Because someone asked me this question, what if we have to organize the symptom, what comes first and next, right? So I hope everyone is still learning with me. And the YouTube students, any questions so far, anything in here, let me know so I can always help you at the same time. Now, without wasting the time, if you have no questions, everyone, let's go to the next question of the screen. And this is the last question for today. So in this question, again, this is a case study, right? So how we should again handle this? You look at the question first. See, it says 3 client findings. Prioritize. 4, follow up. Something bad in there, right? Again, if I can do this question without case studies, you can, but you can read the case study if you still feel like it. But you know how I'm going to look at this question? Nobody can die with diarrhea, skin rash even also that can wait, right? This is a little bit higher, but not that higher. But let me compare with the other ones, right? Why pressurized speech is in there? What's going on in this case study? Okay, why she believes she's a famous artist? Sounds like a delusions, right? So I want to put question mark for this one too. Now between blood pressure and the client not sleeping, and it's 4 days. Oh my goodness, why 4 days? I want to think about this one too. That's why the blood pressure is higher, not resting enough, right? So if you want to do this way, this is a first method, and I'll just pick the answer 3, 5, and 6. But let's compare with a case study, right? If you still want to compare with a case study and see what's going on in here. So you got a nursing notes, first of all, and then you got the mental status examination. So let's read together with me again. And it says here, you have a patient who is brought to emergency at 1 o'clock around by her roommate who reports that she's concerned about the client recent behavior. Okay, this is a story part, nothing emergency for me so far yet. The roommate report the client has not gone to the work. Okay. And also has hardly slept for the past week. Okay. And is observed to be talking excitedly about selling her belongings. Why she's excitedly talking about selling her belongings and she want to move to Paris? Hmm. Because she's a true artist, she said. Question mark. What's going on in here? Seems like a mental health case about it, right? Now, the roommate reports this behavior is extremely out of the character for the client. In fact, she calls a period last month when the client appeared depressed. Okay, but it's important for me to know why she was depressed earlier and hardly left her room also. Is this something because of depression related now what she's doing? This is you guys want to think about it, right? And then when you see the physical assessments is in here, you don't find any physical injury, but the rash is noted on the abdomen area. And she mentioned that she has a diarrhea from past 2 days. Okay. The diarrhea was from past 2 days. Okay. So now pupils are equal, round, reactive to the light, but deny any pain still, right? So round, equal, reactive, I'm not concerned about it. Denies any pain, I'm not concerned about it. Okay, we'll think about the diarrhea later. Client is not taking any medication. I don't really see any fever, but why pulse is high? Okay, respiration sounds okay. Blood pressure a little bit on higher side. Oxygen is still fine. Nothing really concerned for me in here, right? So once you read like this, wait here, everyone. Then you got a piece of paper in the exam. They give you rough paper. Okay. In the rough paper, write it down 2, 3 points, which you think is an emergency for you in the first paragraph, right? For me, I would just write it down, not go to work, and then famous artist, so question mark as a delusion, and then history of depression. This is how I will write it down, right? And then after that, you go to the next paragraph, because if you read the next paragraph right away, you cannot remember the top paragraph maybe by the time you reach to the questions, right? Someone is using my whiteboard right now. I think you guys really like to use my whiteboard at the same time. So please try to avoid it. I can see this is Gulfam here who is using my whiteboard. So please refrain that. Your name is popping up on my screen too. So in the mental status examination, when you read this, again, 2, 3 findings which you can find, just put it in here as an emergency, you think, right? So let's delete the rest of the findings first. Give me 1 second. Okay. Because I want to delete first what somebody draw already in here. So hold on. Okay, now you can read it carefully, everyone. So here, now you see the rest of the part. You will see appearance look like, heavy makeup. Okay, seems like a present condition right now. And I think present is more important now as compared to the whole, what we read on the top, right? So let's see what is present right now. So to read that, let me zoom a little bit for you, everyone, so you can read it carefully. So give me 1 second. Okay, now you can read it carefully, right? So the first part which I'm going to read which is about appearance. In appearance, you will see heavy makeup, bright clothing. Okay, maybe you got the answer, everyone. You got a patient of somewhere around bipolar condition related, and then now what you can think it's about mania and everything going on seems like. And then you have behavior presents euphoria, excited, and says, I feel amazing. She's smiling, very talkative, and have difficulty sitting still, right? Then when you see the speech is pressurized right now with a rapid heart rate and elevated volume. Seems like your patient going right now into acute mania now, I would say. Mohammed is again drawing on my screen. So stop, please, everyone, so I can read it for everyone, please. Thank you. And then in thought process, focusing on one topic, but still oriented to time, place, and person, though does not appear to have insight to her the current condition. Okay. And when you see the last part, this is again thought related, Right now, I don't really see societal, but jump frequently from one topic to another. Because you're mostly focusing on being artist, right? Now, client makes a statement about quitting her job, selling belongings, go to Paris, and she want to pursue her this dream maybe. And then she recently charged 8,000 on her credit card for plane ticket. Oh, wow, that's a lot. And then report from the client roommate that this spending far exceeds her mean, right? So seems like a lot of is going on right now. But when I see they give you only 6 symptoms overall from the case study, right? But overall, only one, how many answers we needed as a priority? Only three answers, which you think it's on the top of the list, something that cannot wait, emergency, I want to look into right away, or maybe tell the doctor quickly, right? Now you think your answer again. See if you still want to keep the answer 3, 5, and 6, the one we did earlier, or do you have a different answer for me as well? Let me know in the comment section so I can read your comments too. And I'm going to go to your chat boxes right now so I can see your comments everywhere. YouTube students, if you have any doubt, any questions, feel free to participate at the same time. Okay. Pressurized speech, blood pressure, no sleep. So when you say blood pressure is the priority for you, Muhammad, right? Can you ignore delusions then? What do you think? And the blood pressure, do you think it's that high that's an emergency and that is not expected you want to look into right away? Right? This is my question then for you. And then, yeah, no worries. 356. Perfect. For rest of the students, what do you think? What's the answer? Okay, try your best to participate because if you're not going to participate, you're not going to learn in there, right? Okay, I can see some answers now. 356. For Noman, the answer is 1, 4, and 6. So when you say diarrhea and blood pressure, Noman, can you ignore about the pressure speech? Because is that when you say diarrhea is an emergency for you or blood pressure is an emergency for you, is that sounds like you want to ignore the pressure speech then? You think that can wait? That's not something you want to look into? And the patient is not even sleeping in past 4 days too, right? So what is more important right now to hold it? And you want to look into that first. This is my question back again for Norman, right? Okay, let me know everyone, because I have the same answer, everyone. I have 3, 5, and 6. But if you are disagree, you have a different answer question, let me know, right? Okay, YouTube students also 3, 5, and 6. Very good, Anshita. And the other students on YouTube, let's see what's the answer do you have? I don't see really any other question on YouTube, but they're participating good. Okay, let's see here. Praveen got 1, 5, and 6. Okay, so when you say 1, 5, and 6, Praveen, 1, 5, and 6. Okay, so when you say 1, 5, and 6, you think diarrhea is an emergency for you as compared to pressure speech? This is my question then for you. You want to treat the diarrhea first and you think pressure speech can wait? Or you want to treat the pressure speech first and then diarrhea can wait? This is again a question back in here, right? Okay, any other students? There you go. Very good, Jatinder. Neuroscience we can't ignore. Very good. See? So the final answer is 3, 5, and 6. If someone has any other doubt, any question for me, you can always stop me and let me know. We can always go back from there. And this is we done for today. And that's all about it. So I hope everyone learned something from me today. Again, how to handle priority initial type of question, how to think what comes first and what comes next. If there is any doubt, any question still, let me know in the chat box still. Yeah, no worries. Yeah, that's all again from me from this side. Perfect. Okay, I don't see any questions so far. So thanks so much for participating, everyone. This video will be saved on the YouTube. If you want to watch this video later on, and if you do have doubts, any questions further, you can always ring back to me and we can always discuss this thing together, right? So thank you so much, everyone. We'll see you guys back again for the next class tomorrow. Thank you.